Hello, everybody. Today I'm going to be going over heart valve disorders. Um, it's chapter 48 in our geriatrics Merck manual. So let's get started. So first we have what is a valve disorder. We have the four types of valves: tricuspid, pulmonary, mitral, and aortic. And the types of valve disorders you can have are stenosis, which is narrowing of the heart valves, and then regurgitation, which is backward leakage of the blood through the valve. And then we have stenosis and regurgitation can occur in the same valve at the same time. And then serious disorders that can occur from untreated valve disorders are heart attack, stroke, arrhythmias, and infections of the valve. Okay, so we're going to go over the types of valves. We have mitral, which controls blood flow from the left atrium to the left ventricle. And then we have the aortic valve, which controls blood flow from the left ventricle to the aorta. And then the tricuspid valve controls blood flow from the right atrium to the right ventricle. And the pulmonary valve that controls the blood flow from the right ventricle to the arteries that carry blood to our lungs. The causes of heart valve disorders can be degenerative calcification, which is calcification that accumulates in the valves, and this order affects 1/3 of people over 70 years old. Then we have myxomatous degeneration, which is the most common cause, and this happens when the valves become floppy and they tend to leak. Some valves are defective at birth, which are congenital, and they cause problems later on in life. And then they can be caused by a heart attack or an infection that occurred. And then probably the least common is rheumatic fever, which is caused by untreated strep throat. So the most common valve disorder is aortic stenosis. This occurs when pressure increases in the left ventricle, making it difficult to pump blood into the brain and other organs. The most common cause is accumulation of calcium that blocks the blood flow. This, however, is not to be confused with aortic sclerosis. Aortic sclerosis occurs in about 1 out of 4 people over the age of 65, and it does not interfere with your blood flow. Patients can feel shortness of breath, faintness, chest tightness, or pain in the chest. Next, we have aortic regurgitation. This is blood flow that's already been pumped out of the heart into the aorta and leaks backwards into the heart. This can be caused by aortic stenosis, causing the valve not to close completely, or it can be caused by the aorta becoming enlarged due to high blood pressure, which causes the valve not to close completely. It can be caused by tearing in the lining of the aorta, which is aortic dissection, or a bulge that forms in the weakened area of the aorta, which is the aortic aneurysm. We also have infections that can cause damage, such as aortic regurg to the heart valve, and then some symptoms they have are shortness of breath, especially during physical exercise, and they feel like their heart is racing. So then we have mitral stenosis. In mitral stenosis, the opening of the mitral valve becomes narrow. Blood flow is pumped from the left atrium to the left ventricle and is impaired, causing pressure to increase in the left atrium. This causes the heart to beat faster, which is called atrial fibrillation. The most common cause of mitral stenosis is rheumatic fever. Rheumatic fever is now rare in certain regions just due to proper treatment with antibiotics to strep throat that we have now. And then also the symptoms they can have is shortness of breath during physical activity. If it's worse, it could be at rest. They can have abnormal heart rhythms. And if it isn't diagnosed in time, it usually isn't diagnosed until the patient has maybe had a stroke or something, of the sort. So then we have mitral regurgitation. This is when blood leaks backwards through the mitral valve each time the left ventricle contracts the blood into the aorta. The mitral regurgitation is usually mild in elderly patients and doesn't require much treatment. Usually it's caused by calcium accumulating at the bottom of the mitral valve, and it can be caused by heart attacks and degeneration or infection. It usually doesn't cause any symptoms. If they do occur, they're mild. They can have shortness of breath and maybe a racing heartbeat. All right, so you'll start to see a trend in the symptoms and treatments for these heart valves. Typically, most of the symptoms are dependent on how quickly the disorder develops. The most common is shortness of breath. You can also have chest pain, rapid heartbeat, arrhythmias. Most people with heart valve disorders, drugs are effective for treatment. Typically, they're antihypertensive drugs, such as calcium channel blockers and angiotensin converting enzyme inhibitors to reduce the workload on the heart. And then we have beta blockers, which are also used to slow the heart rate, so the blood has more time to pump, or the heart has more time to pump the blood through the valve. And then we have Warfarin, which increases the risk of bleeding. It decreases the risk of bleeding, especially in older people, so that it prevents clots from forming. Okay, and then we have heart valve replacement, which is a surgery that replaces the heart valve that has been severely damaged with a mechanical valve or either a metal or tissue valve that could be made from pig or cows typically. It's very effective and it can prolong life. The heart valve replacement does require 2 to 5 hour open heart surgery, and it can have risks, especially for the elderly. And the recovery for the heart valve replacement is about 6 to 8 weeks.